Welcome back to the Equity Matters Podcast. It's your host, JV3. And here on Equity Matters Podcast, we champion equity in every conversation. Ironically enough, the last time that I recorded an episode was shortly after the election. And so that places us in November 2024. We're now in March of 2025, and so much has occurred. Also, ironically, I am sitting in a hotel in Washington, D.C., or at least outside of Washington, D.C. I'm in Virginia, I think. And I'm here talking about health equity. If anyone has been following the news over the last few months, you know that certain words and terms are under attack. And we've seen this in a way of saying that certain words shouldn't appear in grant documents and work plans or other resources that are used to really articulate what it is that we do. And I want to affirm you all that the work itself isn't going anywhere. I think in many cases, a lot of us public health folks, social work folk, other helping profession folk, we have a responsibility to more or less provide services in ways that benefit those who need it most. Now, the manner in which we do that may look different depending on where you sit and how you do your work. But for the most part, I think many of us have more or less a legal responsibility just as much as a moral obligation. What I've observed is that there's a lot of effort being taken right now to dismantle efforts, or at least dismantle what has been done around resources and programs and policies that support the most marginalized, perhaps the most vulnerable. And it's unfortunate. And I think in many cases, it's interesting. And one would wonder, well, why, James, do you think it's interesting? Well, because this is not the first time that this has occurred. If you look back through history, I promise you that you will see this kind of pattern, if you will, where something happens that's against the majority, and you will see individuals who are rising up perhaps as voices for those who are deemed the voiceless. And you have a majority group that is now saying that, well, our power is being threatened. What do? Well, we find a way to censor. We find a way to disarm. We find a way to attack and antagonize. And you can go back as early as, I want to say, the Reconstruction era, where you started to see these programs that were being developed. You see the birth of historically Black colleges and universities, where you see formerly enslaved persons finally being in a place where opportunity is available. And what happens? Well, you create the sharecropping system. You find other mechanisms to codify oppression. You think about Jim Crow laws. All of those things are the same vein of strategy that we're seeing right now. You can think about some of our civil rights leaders, if you go back to the 50s and 60s, being called out as communists, right? The Red Scare. All of these things are tools that are being used, one, to minorly distract you from what's going on, but mechanisms that reduce accountability, because now my attention is elsewhere. So this attack on language that we're observing right now, one, be conscious that it's purely an attack on language. What I've been telling my peers, the people that I care about, the people that care about this work, we're still going to do it. It's whatever you want to call it. The name may change, but we still have a responsibility to serve. And so if people want to spend time debating the mechanics or the vernacular or the vocabulary, bickering over things that don't matter, have at it. Take your time, chew apart every work plan that I submit. My responsibility is to the people. And so as I prepare documents, if you need me to change the words, so be it. Does it conflict with my values? It does. It's painful. It's difficult for me to go through resources that I've created, have conversations that mean something to me. And in some cases, it feels like sugarcoating, but other cases, like, if I don't do this, what happens to the people that I care about, the people that I'm supposed to be responsible for, the people who are counting on me? I think we have two options. One of them is to perhaps change the language, right? One of them is to say, we're not going to say these things, but we're still doing it. And the other is to be more resistant, which I think has its pros and cons. I think we're in a place right now where there's not enough resources on certain levels to attack, and we can get by with doing what we've been doing. I'm also thinking a lot about how over the past few months, two very clear instances of power have come up. And the power in information or communication and the power of financial resources. So back in January, when those executive orders first came out, there was a cease in conversation. There was a halt across a variety of platforms. And a lot of my conversation comes from the Centers for Disease Control and Prevention. And when you're trying to do a huge project like some of the ones that I manage, it's hard to do your job when you don't have access to information, when things are constantly changing. But that is a demonstration of power. And the moment that you realize that, it's like, okay, I see what you're doing here. The strategy, it's fine. Of course, you have relationships that you've built where you can start to have conversations with folks and say, hey, I might not be able to talk about this thing, but what can you tell me? And this goes into the power of collaboration. So much of what we don't do alone. And we're never going to be successful if we're trying to do it alone. So lean on your partners in doing this work. The other piece is around money. So a lot of my nonprofit partners, a lot of our even other states are seeing this where, you won't be funded if you do gender affirming work, if you do racial equity work, if you do diversity, equity, inclusion work. Okay, sure. The threats are there and they're legitimate. I think the doomsday planning that I have been experiencing for the last few weeks, it started to take its toll on me because it would seem like every conversation, there was never progress. There were just more problems. And that can be difficult for someone who's like thinking about solutions, who's thinking about, well, how do we collaborate to make these things better? And it just seemed like there was no better in this scenario. We have to find a better way to, one, digest information and understand when we have to respond to it, if we have to respond to it. I think a lot of us get into that reactive state where we're knee jerking and it's like, oh, this thing has happened. What do we do? Sometimes it's okay to pause. Sometimes it's actually okay to do nothing. Because what I say happened is they showed their hand. That doesn't mean we have to show ours. I've witnessed now a few different large scale projects where, well, how do we revamp our work plan? Are there alternative languages or alternative terms that we can use that won't be flagged? Well, there could be, but is it really worth the effort to go through these 1,000-page documents and try to soften the language? Maybe not. I think where we are right now as a public health community is we got things to do and the distractions are there. Trust me, I know. I'm on the debriefing calls. They are there. But we have no choice but to rise to this occasion. I had a post on LinkedIn. I can share it in the comments where I talk about public health always being at a crossroads. We've always been in this place. We rise up in situations where we have to be resilient, but also where we don't have all the pieces together. One of the fundamental tenets of emergency preparedness is share what you know, say what you don't know, and let people know when you'll be back when you do know. And I've taken that kind of approach with a lot of these conversations that we've had lately. I don't have all the answers. No one does, unfortunately. What I do know is this, that I have my values aligned in a way where social justice, where a list of other words that shouldn't be said are a part of who I am. It's part of how I show up, how I do my work, And I know there are other people out there who are just like that. And so I think it's up to us to continue to be steadfast. And I've been thinking a lot about this metaphor of the waves. You have these waves that come in to the shore, and you have these waves that will take you. And if you are a boat without a paddle, you are bound to go in any direction. But if you are a lighthouse, if you are fixated on what is ahead of you, the waves are going to come, but you won't move. You will merely continue to look out. You will see the vision. And if health equity and improved health outcomes and reduced differences between populations is a part of your vision, let that continue to guide you. Let that continue to guide your work. It doesn't matter what you call it. Let it guide your work. Let it dictate the way that you allocate your resources, the way that you design your programs. We have no choice because we've seen these disparities for far too long. And I think we're finally at a place where we're starting to make progress. We were starting to say the things where I've been in meetings where we are comfortable saying terms like white supremacy characteristics. It's like, wow, I've never in my career thought that we would get to a place like this, where we're able to talk about how certain policies can be racist, where you are able to say the things that have been censored for so long. It doesn't go away just because one person says it has to. The issue is still there. And so maybe our solutions have to change. One thing that I really want to direct your attention to is the work that I've been doing on YouTube. And I started a series, it's also on Instagram. Both links will be in the description. But words I'm still using, and you should too. And part of it is obviously a joke of what's going on around us, but also a mechanism to build community around people who understand why this work is so important. So I want you to check that out. Be sure to like this episode, follow us on all your social media platforms. I don't have X anymore. And honestly, I don't know if I'm still at SJV3 or not because I got rid of my Instagram. But please, make sure you find us on YouTube, subscribe on whatever digital streaming platform that you're using. I've got a few more things that I've got lined up. As I mentioned, I'm in DC right now talking about health equity. I'm excited I'll be on a panel tomorrow. I'll try to get some footage of that as well. But in the meantime, in the comments, make sure that you're talking about how this work is impacting communities. We need to do a better job at telling our own stories so that people can hear us. I think we've gotten kind of comfortable with when public health is working, nobody knows you're there, silent footsteps, we're the shadow beside you. I think it's time for us to be at the forefront and to be honest about who we are, what we do, how we do it, and be unapologetic about it. And so until next time, folks, you already know, equity matters.